Thanks for staying with us for TV5 News at 9. This weekend is the Big Kappa Alpha Psi Fraternity All Men's Health Fair. Joining us this morning to tell us all about it, we have Dwayne Parker from the Saginaw chapter and Dr. Mayar Jundi, who is from Covenant Healthcare, cardiologist. We appreciate you being here. We were talking at the break. This is really a unique event.
Thank you. Thank you so much.
Tell us how this all came to be.
Well, there are many statistics that identify men's health where failure to go to a doctor unless they are in extreme pain. Men are living less than their female counterpart. Men tend to take better care of their cars than they do themselves. And so we as a male fraternity decided that we wanted to put together an event that addressed men's health issues, screenings and things of this nature that would really launch them into a better path of taking care of themselves.
In 14 years, that's a long time.
We've been at it, and we are excited of the fact that it lasted 14 years because of the healthcare community, like Covenant and our friends here that have supported it over the years. So we're excited about that. Longevity.
And we should also talk about, Doctor, you know, we were talking in the newsroom on something separate, but we were saying you cannot take your health for granted. It is so key.
Absolutely, absolutely. Even when you're feeling good and nothing is going wrong, you still have to go and see your primary care physician to check your blood pressure, do your annual labs, make sure you did not develop some kind of a disease or a medical condition can affect you. Since I'm a cardiologist, I want to talk about hearts did not affect your heart or can affect your heart in the future. So blood pressure check, diabetes, sugar, checking if you have any other conditions, especially with people who have already certain factors they cannot change. For example, for men's health especially, there are certain factors that we cannot change. So the fact we're getting older, the fact we are men, our gender, and some people have what we call a history of a premature coronary artery disease in their family, like their father and siblings, first degree relatives have heart disease at young age. These factors exist, genetic factors that we cannot change. So it's very important to change the factors that we can, such as diabetes, high blood pressure, make sure we are exercising, control the weight, stop smoking if you're smoking, alcohol intake, all of that we need to pay attention to prevent a problem. It's very important to treat those conditions early on than dealing with a major problem such as a heart attack or heart failure or a major disaster in the future.
Yeah. Well, why is Covenant Healthcare, you know, getting involved in this, we should mention, and also kind of what health screenings will we see?
So it's very important to take care of our population in the area. Covenant is there for that, but it's important to give education to the people that you have to take care of yourself. So we'll start with our network of a primary care physician, where it's important to have a primary care physician who will take care of those issues. And if we realize you developed a heart disease, then it's very important to see the cardiologist at Covenant, where we can take care of those diseases and treat them early on, instead of dealing, as I mentioned, with a major heart problem in the future.
And this is really about commitment to the community.
Absolutely.
All right. We should ask about, too, with this special day, what ages can attend?
Well, from 18 on up.
18 on up,
and
okay.
we feel strongly that you need to start early.
Okay.
Men that are, young men that are healthy, there's still a need to get a checkup at that particular age at 18, maybe every 3 years. But when you begin to age, you should get an annual checkup on a regular basis, annually. And so that is the age that we're looking at attending.
And what sort of health screenings will you offer?
Some of the things that Dr. Jundi just mentioned, but we have a plethora of health screenings, from hearing, we have diabetes, of course, blood pressure and cholesterol checks, BMI checks, things of that nature, and just a host of other health screenings as well, depression, nutrition.
Now, do people need to register or have health insurance? How does that work?
This is a totally free event, no pre-registration needed, no health insurance needed. It's open to the public. We have a lot of fun at this particular event. We have some great raffle prizes that we are offering.
You do.
And you have to participate in the health screenings in order to be eligible for those prizes.
All right, remind us again the times and place.
This is Saturday, this coming Saturday, the 14th, June 14th, from 10 a.m. To 2 o'clock p.m. at the Horizons Conference Center.
All right, everybody should attend then. 18 and up, no excuse. It's a great way and some great prizes too. We appreciate you both being here.
Thanks for having
Thank you.
us.
Thank you.
All right, we're back in a moment. Oh, remember too, hot links, I apologize, WNEM.com, right there at the top. We have the information there on your screen that you can get all the details as well. Very easy to check that out when it's convenient for you.